I'm going to talk to you a little about the rotator cuff. That's really the engine that drives the shoulder. If you ever wonder how someone can pick their arm up, how they can put it out in different directions behind their back, well, that's because of the rotator cuff. And if you think about the shoulder, it's a ball and socket joint, right? The ball sits in the socket, it's held in place by a ring of ligaments called the capsule. Overlying the capsule are 4 rotator cuff muscles and their tendons attached to the head of the shoulder, right? There's one in the front that's called the subscapularis. There's one on the top that's called the supraspinatus. And that's probably the most important one and the one that you hear about when someone tears their rotator cuff. And basically that's the one that helps you lift your arm up. There are 2 in the back, the infraspinatus and the teres minor, and those help rotate your arm out. Now you need all of those to work together to produce the most effective motions at the shoulder. And if you think about tennis players, every single motion they're making, every stroke they take, the backhand, the forehand, the overhead smash, or the serve, they're using their rotator cuff muscles. If one of them tears, then the shoulder's going to be out of sync and it's not going to work properly. It's going to put extra stress on the shoulder and hurt more. You could certainly get a tendonitis, which is very common and due to overuse, and that gives you shoulder pain, but oftentimes you can work through that or take medicine that helps you. However, if you tear your rotator cuff, then you're in serious trouble. And that's basically where the tendon that's holding onto the muscle attached to the head of the shoulder pulls off. Unfortunately, those don't heal on their own. And the only way it heals is if you actually do surgery that takes that tendon and you pin it back down to the head of the shoulder. And when you do that, it's very effective. It heals and people get back to doing everything they want. But it's a really lengthy recovery process, often taking 6 months or more. And certainly in these elite athletes, it may take them a full year before they get back to playing at the same level.